Okay. Good afternoon. Good afternoon, everyone. We are sorry for the technical difficulties earlier. Um, on behalf of the Museo ng Kaalamang Katutubo, I would like to get the ball rolling by introducing our speaker. Um, with your indulgence, Dr. Paul Gideon Lasco is a physician and a medical anthropologist. He is senior lecturer at the University of the Philippines, Diliman, and a research fellow at the Ateneo de Manila University's Development Studies program. He obtained his medical degree from UP College of Medicine and his PhD from the University of Amsterdam. A Palanca winning essayist, he maintains a weekly column, Second Opinion. I think it comes out on a Tuesday, in the Philippine Daily Inquirer, where he writes about health, culture, and society. Uh, this is the second time he will be providing the lecture, as he concluded the first run a while ago. We are very sorry, and we thank Dr. Lasco for his indulgence. I think he's ready. Doc, without further ado, if we can have your presentation. Thank you.
Hello, everyone. Good afternoon to all of you. So I hope that you can see my presentation. Can I confirm that people are seeing it? So what I'm going to do now, briefly, is to really run through everyone into what has transpired over the past 6 months and even before. Because if we think about it, if we try to recall the first time we actually wore a face mask this year, and if we try to remember when it was the first time we saw people wearing a face mask, then we will be reminded that in fact there were these images of people wearing masks, but these are not because of the pandemic, but these are in response to the Taal volcano eruption in January 12th of this year. So people took to wearing masks. That was the first time people hoarded masks, not just in Batangas or Cavite, where it was really a threat, the ashfall, but in Metro Manila and even in Mindanao, there were reports of drugstores, pharmacies running out of face masks. Prompted the DOH at the time to say that, well, you can use anything, including bra pads and diapers, to avoid ashfall, as even as they try to assure people that there's no need for masks in most parts of the country. So even if we might think that what's happening now is really exceptional, and in many ways it is. But when we look at the history of face masks, actually longer than our experience now. So I show you the Taal volcano, where people's hoarding of masks made it a currency of greed, but also goodwill, because people also shared them as a sign of solidarity and compassion, kindness. This picture of a man distributing face masks went viral because it shows and reflected people's spirit at that time. Of course, we didn't know that Taal volcano would be a mere foreshadowing of the bigger crisis that was ahead. But even before Taal volcano, we also saw how face masks were used in Mayon in 2018, Pinatubo in 1991, and beyond volcanic eruptions. We also saw people wearing, buying, hoarding face masks during the SARS outbreak in 2003. So at some point, there were also requirements to wear masks in certain parts of the country. Some government institutions required them. Airports were filled with masks, same sites that we saw in the same airports in the early months of this pandemic. And people were also trying to think of which masks to wear. So I will quote an observer at the time, Dr. Bondok, who said masks are everywhere. They're the most coveted and most overpriced commodity in the market. Sadly, they're also the hallmark of an open society now seeking to protect itself from an unknown enemy. So we saw how masks were used at that time. And the same attitudes that people have now around the pandemic were also observed during the SARS outbreak, even though we have largely forgotten all about these, from wearing masks to avoiding people quarantine, etc. To a lesser degree, we also saw people wearing face masks during the H1N1 concern and scare in 2009 in Metro Manila as well and other parts of the country. What we saw basically over the past years is really the fact that people have been using face masks a long time to protect themselves from disasters, crises, and the motivations around mask use go beyond simple considerations of biomedical efficacy, meaning to say it's not just because people say virus can be prevented because of face masks. It's not just because of that imperative that people wear masks, but cultural values as well, perceptions of control, social pressure, nakakahiya, baka isipin nila hindi ako sumusunod. So all of these things inform people's decisions to wear masks. And there's one difference between volcanic eruptions and infectious disease, which is that whereas ashfall and the volcano is a tangible physical presence, infectious disease has an invisibility that makes it particularly scary for people, and face masks are a symbolic and physical barrier against that perceived risk. So the first insight I want to impart this afternoon is that face mask wearing is not an exceptional but a familiar response to health and safety threats. Now, going back to COVID-19, it's been 6 months since this whole crisis really started. But let's bear in mind that in the first months of the pandemic, the DOH was actually telling people not to wear masks or that masks were not recommended for public use. And that's the same thing with other countries. People were really all over the world. Governments were saying that if you're healthy, there's no need to wear a mask. Only if you're a healthcare worker, if you're sick, or you're taking care of someone with suspected or COVID infection. But as the pandemic progressed, with changing knowledge about masks, with changing gravity of the crisis, and changing political currents, we see how face masks now are mandatory since April in this country. The WHO itself changed their position over a span of 2 months. So in April, they were saying that there's no evidence to wear face masks. On June 5, they were acknowledging that there might be some they were taking into account available studies that might say that there might be some evidence for face mask use. And others argue that, well, we don't really know. There's poor quality studies, but we should apply the precautionary principle and say that we need to have universal mask wearing in any case, regardless of how strong the studies are. Some of the studies invoked to support face mask use drew on the pattern of countries that require face masks having lesser or better trajectories in terms of COVID-19. But this has also been criticized, saying that we cannot infer based on the country level data. So there's so many other arguments for and against then and now. Some studies that show a big impact of mask use have been also questioned, and there's really a lot of debate around face mask use, in other words. And all I want to stress at this point is that this is a fraught topic. It's a contentious topic, and politicians, public health agencies try to decide based on what little information they have, and it's constantly evolving. So even cloth masks, particular kinds of masks are also being studied, whether they're actually effective. So we don't, and I don't know personally, but personally, I think that we need to really err on the side of precautionary principles. And just besides, the science has really been mounting, supporting. So I think now the balance has really shifted in favor of face mask use. But all of these examples show that the nature of scientific knowledge is really evolving and not independent of social and political influences. So that's the second point I want to make. And now we see that it's still not universal. Many countries still don't recommend face mask use, including New Zealand, the Scandinavian countries, etc., and many states in the US. Meanwhile, in the Philippines, we see that people are actually following mostly based on these surveys, which we can also criticize. But some surveys suggest that most Filipinos are actually following the mask mandate. But as we also saw, this use of masks is really informed not just by the belief in science, but also the compulsion to obey authority because you might get arrested. So there's a punitive approach. But more powerful, I think, is the social societal expectations of mask use. That you don't want to be shamed and you want to be a good citizen. There's policing offline and online, even though health psychologists actually tell us that it's not the best way, it's not an effective way to get people to wear masks. But we see it going on, both offline and online, people being shamed for not wearing masks. So so very quickly, the third insight I want to really impart is that wearing face masks has come to signify solidarity and good citizenship in the time of pandemic, in the same way that wearing a seatbelt, for example, or doing other actions that constitute responsible citizenship. But at the same time, and this is a very old illustration of Mary Douglas, a social anthropologist who studied food, and she said that we can actually plot people's food sharing with our social universe. So the smaller circle is a circle of people you share meals with, and that's smaller. And a bigger circle is the set of people you share coffee with or you share drinks with. So for her, a full meal is a sign of a greater intimacy, and you only invite people or you only eat a full meal with people you're closer with as compared to people you have coffee with, for example. And I think that in this time of pandemic, in many ways, our use of face masks is also influenced by this kind of thinking, even though they don't necessarily intersect or they don't necessarily overlap perfectly with our biomedical prescriptions. For example, you have an aunt who's living in a different household and she pays a visit, but do you wear a mask in front of your aunt? So it causes a lot of friction, tension between people. So there's a lot of awkward situations around face mask use. And that's because face mask use is really a negotiation between social relations, our own sense of risk, and also the biomedical imperative around face mask use. So personally, I've experienced an awkward situation in which I saw a friend and was with a common friend and I wasn't sure. We were both not sure. So we were friends of a friend. So we were common and our common friend wasn't sure whether to wear a mask in that context because we were not that close. But otherwise, they wanted to wear a mask. So there's a lot of awkwardness around it. When I'm running also, I'm not sure if people are open-minded to running without a mask. So WHO actually recommends that you can exercise without a mask, but we know that it's different. It's situational. It depends on where you are. So I'm sure you can also think of these awkward situations around masks, which goes to show how they are in tension with our social expectations, our social universe. Another influence to face mask use is this notions of gender. So studies around the world are emerging to suggest that men are less likely to wear masks. So there's feelings of shame, sign of they think face covering is a sign of weakness. We don't know in the Philippines, although I'm hearing from the people I interview that it seems that this is also the case in the Philippines. But we need more studies to reflect and to document how gender, age, class, geography can affect people's attitudes towards mask wearing. So some have even compared the use of face masks with the use of condoms and how there are similar narratives around both. So what else are other factors? We don't know. That's why we need to explore. And this is the role of anthropology in medicine. This is applied medical anthropology, in which we can apply anthropological methods, applying our insights about culture to help address a public health concern. So for those of you who are clueless as to what anthropology does, this is one role of anthropology in public health. And it's not just anthropology, but other social sciences, also health psychology and other fields that can contribute to our policies by understanding the reasons, motivations, people, and observing them in practice because what they say don't necessarily correspond with what they do. But the fourth insight I want to share, the penultimate insight, is that face mask use in practice is subject to pakiramdaman. People feel each other out. And this is based on a sense of familiarity, intimacy, gender identity. Now, before I end, these are just a rundown of some photos of people's face masks just to show how it's evolved a lot. So it's now a protest. It can be used for protest. It can be part of people's costumes and uniforms. Face masks have also entered the fashion industry, so they're now selling masks. Designer masks are now being made as well. People want to look fashionable with their masks. So the question I would like to ask people, and that's what I've been asking people, is what is a good mask for them? And what is a good mask for you? So is it something that, are you concerned about the feel of it? And these are the responses I hear. People are concerned about the smell of the mask, the fitness, dapat bagay sa mukha ko, it has to be good quality. The thickness of the mask also, dapat madaling labhan, hindi dumihin. So there's more pragmatic concerns. We see people by experience experimenting also on what's a good mask for them, and evolving as well around it. And people also use different masks for different occasions. People who go to a hospital might wear an N95 mask, as one of my informant told me, but others just wear any mask because it's just for compliance. So as one of my informants told me, kahit ano, basta may mask. And finally, we also see, because masks are material, we feel them, we can feel hot if the mask is too thick. They are material objects, and as such, they're also raising environmental concerns. So what we do? And I see when I bike around, I see so many masks as litters in the street. So what do we do with all of this waste? And that is also an issue that we have to grapple with. What material to use for the mask? And all of this just points to the fact that face masks have become a part of our bodily and material culture. But for how long remains an open question, given that it might be normalized, as in Japan and Hong Kong, where it's really seen as a natural practice to do masks. But it can also be that we might feel that we want to forget this horrible moment in time, and masks will remind us of the pandemic, and it might fade away. So we will see. We need to keep documenting and understanding masks. So very quickly, just to summarize, face masks are a familiar response to crisis. They have biomedical efficacy, but they also have social efficacy as signs of good citizenship. And in practice, we can see how face mask use aligns, but sometimes also comes into tension with people's social universes and their cultural notions of gender, class, identity, perceptions of risk. And finally, as Dr. Tan will talk more later, face masks have become part of our bodily and material culture, although we're not sure how long. Thank you for listening, and I look forward to your questions. Thank you.
Thank you, Dr. Lasco, for your insightful presentation. I'd like to ask the audience to reserve the questions for later. We'll see how we can manage the Q&A after the talk of the second speaker. I would like to introduce now the second speaker. He really doesn't need much of an introduction, but I will go through the motion anyway. Dr. Michael Lim Tan is a medical anthropologist. He's a veterinarian, a writer, professor at the University of the Philippines, Diliman, College of Social Sciences and Philosophy. He is also a clinical professor at the UP College of Medicine, Manila, a member of the National Academy of Science and Technology, and recently served as a UP Chancellor between 2014 until this year. That's his nickname. People call him fondly as Chansey. He has authored numerous books and articles, given talks on indigenous medical beliefs, pharmaceuticals, health policy, and gender issues, as well as reproductive and sexual health. We are happy that he has chosen to engage us this afternoon. I hope Dr. Tan is ready. So let us start his presentation. Doc?
Good afternoon, going into the good evening, no, to everyone. I won't go into an introduction and more just go straight into this, no, into the PowerPoint, because we're delayed, no, but I hope we'll have time for questions. You'll notice the titles are very similar. Dr. Lasco, Gideon, started out with medicine and ended up on culture. So I'm going to take up culture and will end up in medicine. Okay, a very quick outline of the presentation. I'll introduce culture and medicine, talk a bit about mask use, but Gideon has done a lot of that. And then very important here, the core of the presentation will be cultural histories of masks, in the West, in China, in the Philippines. And then we talk about recommendations for the management of COVID-19. Okay, the COVID-19 pandemic, there's a lot of research that's going on in the medical field, but the social scientists tend to have been left out, despite the importance of doing research in that area, especially how culture affects public health, especially for infectious diseases. And from time to time, you'll see something coming out in the newspaper, very rarely in journals, and pointing out that there are countries where COVID-19 prevalence is low, and people have seen, social scientists have seen that it tends to be related to, in countries where direct body contact is not favored, for example, handshaking, hugging, you also tend to have a lower prevalence. And of course, also important are the normative practices. An example here, this came out in The Economist just last week. There's an article, why has the pandemic spared the Buddhist parts of Southeast Asia? Kaka-intrigue yan. They were pointing to Vietnam, Cambodia, and Laos. And the article talked about things like because they're poorer countries, so there is less of air conditioning. Something like air conditioning is important. Air conditioning actually favors the transmission of the virus. They talked about the younger population, but they also mentioned that in these countries, handshaking is not normative. Instead, they do the Y. That's the photograph there. The Y where you put your palms together and you bow. So maybe we should be encouraging the Y here in the Philippines. It's safer, because we Filipinos are huggers. We want to greet each other very warmly, but we can't anymore. So we're doing elbow bumps, foot bumps. Let's think about the Y as another way of greeting, and it's a safe way. But it shows culture is important. Okay, the use of masks. There are all kinds of masks that are being advocated now, and it's certainly one of the most important. Medical term is non-pharmaceutical interventions for COVID-19. But very noticeable, and Gideon has pointed that has shown some of the figures. Medyo iba lang yung presentation ko dito. It goes horizontally, and you'll find the Philippines is at the top of several countries, with 92% saying that they always use masks when they leave the house. And then you'll see Norway, Denmark, Finland, and Sweden. The majority of the population do not use masks. And then some people say, you see, hindi naman masyadong problema sa kanila. Actually, problema din ang COVID-19. But we should also consider there are many other things that come in. The US, for example, has 59% saying that they always use, but there's a lot of opposition, which we're going to be talking about later. And we have to think also about population density. For a country like the Philippines, we cannot afford not to use the mask. Masikip tayo, maraming tao. And it's suicide not to use masks. Okay, so we are interested in looking as social scientists, what are the cultural and historical factors that might facilitate acceptance and use of medical masks? And I'm going to start off first with the cultural aspects here, a kind of global survey. And of course, this is not the main objective of the presentation. And I wanted to acknowledge that I'm using materials for this brief survey from a book called Mass Faces of Culture. This came out together with an exhibition in the year 2000. It went to 3 cities in the States. It had great impact, and they produced a book. John Nunley is a very good writer, and the book is amazing. And I was fortunately able to get it in time for our presentation. Okay, ang punto lang dito is the use of masks goes way back in time. We have from the Paleolithic period. There's an example here, the White Lady of Tassili in Algeria. May mga cave paintings, and this one depicts a woman, no? Apparently wearing an animal mask. Nakita ninyong sungay, no? Okay. And the question really is, why do we have such a long use of masks among human beings? No? In the year 2016, there's another very good exhibit, and I thank Albina for pointing this out, just by John von Alphen, who had an exhibit in New York's Rubin Museum called Becoming Another. No? Very, very appropriate. No? Na ang tao, no? We like to use masks because we want to take up another identity. No? And why do we do that? The exhibitions of 2000 and 2016, and I hope later in the Philippines we'll do our own, show that people do use masks for various reasons. No? And one, which is what you see in the rock paintings, no, the cave paintings, is to engage with the supernatural. Meaning the idea is by using a mask, you transform your identity and you can talk with the supernatural. No? This is very strong in shamanic traditions. Shamans are healers, no, and religious practitioners that claim to have being able to communicate with the supernatural. No? So sa kaliwa, may makita kang Eskimo shamanic mask. No? You can see isang matang pikit, yung isang bukas. No? And when they go into a trance, no, they say that they are able to communicate with the supernatural, and the supernatural can communicate with humans. The right side is very interesting also. This is called the transformation mask, which dates back to the 19th century with a group, one of the first peoples of Canada. And I'm just so amazed with this mask. Makita ninyo that there's an outer mask, no? Nakabukas siya. Can you see that? There are two eyes there. And when that opens, you have another mask inside. No? So what you are seeing right now is a second mask. And the shaman, as he dances around, you get different views of the different masks. No? So you can say in a way, may pagka-schizo dito kasi nagpapakita ng iba't ibang muka. No? Okay. The next slide shows masks were used also for rites of passage. No? On the left side, you have a particular mask that was used in Congo, no? And it is worn by people in the tribe. No? And this is a mask that allows them to kidnap young boys, no? So that they can be circumcised. It's almost funny. Because circumcision, the idea of circumcision is really to take young boys away from their mothers and transform them into men. No? So the mask there allows them to kidnap the young boys, no? Who of course do not want to leave their mothers yet. No? On the right side, we often forget that the Egyptian mummies and their tombs, those are masks as well. No? And the idea here is that the representation depicts them as dwellers of the next life, no, of another world, and therefore legitimizes their entry into another world. You can see there's a lot of interest in death, no, the use. Okay, you also have masks used for rites of community renewal, no? Especially in agricultural societies, maraming mga rituals na ginagawa, kasama na rin yung Pilipinas. This year we did not have the fiestas of May. But really, the fiestas are time to renew our ties with the land, with the gods, with the saints, no? And this is very important. No? Many societies also have community renewal through the Mardi Gras or carnivals. No? And again, this year it was muted because of the pandemic. No? On the left side, these are paper mache masks used in Haiti. Of different animals. So you can see the transformation is not just to other humans, but also taking on animal personalities. On the right side is, of course, your famous lion dance, which is to renew the community right before the entry of the new year, the Spring Festival. Okay. And then you have the use of masks for theater. the parenthetical remark there is, oh, but isn't life one big theater? On the left side, many of you know this. These are no masks, no Japanese no mask, NOH, and they seem expressionless. But for example, the mask below the man, no? If you look at him, around the eyebrows, he's supposed to project sadness. No? On the right side, you have I think that, yeah, this is a Thai mask from Thailand. All over Southeast Asia, the Ramayana is constantly being staged. No? And this is Ravina, who is the arch enemy of Rama. No? And he's supposed to have 10 heads. So ang ginawa sa mask, they depicted 3 heads in here. And I could go on and on. The use of masks, no, the masks representations are just so amazing when you go across the world. No? Okay, and let's not forget that the masks, the creation of masks continue to this day. No? You might be wondering what these are. These two are American, no? And they are products of American society, modern society. The one on the right side is a mask used by the Philippine Air Force, the U.S. Air Force. It's so cute and cuddly, right? And it's a mask used for cold weather. No? It keeps them warm, the face warm. No? The left side is a bit more sinister. This is used by law enforcement agencies, and nakakatakot na ang mukha. And the intention is, in fact, to intimidate people, no? By taking out the facial features except the eyes. And these are used by law enforcement officers who are going after snipers. No? So you can see that even modern societies do use masks. No? Okay. And then, of course, our interest is medical masks. No? In more recent human history, you have face coverings to protect people. And this only comes starting the 20th century, because the germ theory is fairly recent in human history. The idea na nagkakasakit tayo dahil sa mga mikrobyo, and the idea that you could use masks to block the infectious organisms. No? Okay. So this slide, I'm going to do 3 cultural histories. No? This is a very good research method. Na you look at the history of particular cultural practices. In this case, we'll look at very broadly the cultural history of masks in the West. No? To explain also, we're going to end up with the United States. No? The etymology of the very word. No? I'm not going to talk about Egyptian all. No? Pero ang Italian maschera means an object placed over the face. No? Cara or cara in Spanish. No? And it's to conceal the face. No? And remember, to conceal, no? Tinatakpan. And conceal, of course, has a more negative implication here. No? Conceal, possibly to deceive. No? But we also know that in the West, people would use the mask in masquerades, no? Which were festivities and ritual performances. A bit more detail here, masquerades. No? Masquerades were associated with the carnival, no? the Mardi Gras, but they were also very popular in the rich. Ang mga parties ng mga rich, they were playful and seductive. And it's interesting too that it was also used as occasions where people could speak their mind, no? Political ito, without revealing their identity kasi nakamask na sila. No? So, as I said earlier, in the West, masks tend to have connotations of concealment and deception. No? Also, that ang gumagamit ng mask are mga bandits from Zorro to the Lone Ranger. No? I said here ambivalence kasi they're not really seen as bad. No? But si Zorro at Lone Ranger are not seen as bad. But in broader popular culture, ang mga nagmamask ay mga magnanakaw nga, no? Mga bandido. And then, something that I realized while compiling this, no, you find that masks tend to be associated with so-called primitive groups. No? We anthropologists don't like to use the term there. And ethnographic museums have highlighted this by showing masks and associating it with so-called primitive groups. No? So in a way, you can say that the West tended to look at masks as manifestations of being primitive nga. No? And it fed into a certain exoticism and worse, suggested the occult and the dangerous, a transgression of the natural order of things, versus civilized groups, so-called, which don't use masks. So it's important to look at that angle. And another important point is that masks were not part of daily activities in the West. It was used only for masquerades, and certainly masks were not part of the community's cycles of life. Unlike what we saw earlier, you start the new year, you start the season, you start the carnival using using masks. They were also used occasionally for entertainment. We're going to see that later on. And they were used by bandits as well. Pero maraming mga gamit, unlike the West. And unfortunately, in the West, medical masks, when they were introduced, they were first used. But in the current pandemic, it hit the US at a time when they are highly polarized between the Republicans and the Democrats. And the masks were weaponized. The conservatives opposed the mask, saying that this is violating their personal liberty. Malakas ito sa mga Amerikano. You do not force me to wear. There are debates even as we speak today na lumalaban sila na they don't want it to be made mandatory. And together with that, of course, maraming mga conspiracy theories na hindi totoo ang COVID and all of that. Okay. And we know that the opposition has turned violent. This is one picture of in a Florida Walmart supermarket where a man actually brought out a gun because he was asked to wear a mask. You can see the little girl there pulling her father kasi natakot siya. It's really horrible in the States. They're so uncouth and uncivilized. And it's interesting that in another incident, also in Florida, I don't know what it is about Florida, a man naman threatened to shoot people because he felt kulang yung enforcement naman ng use of masks. So you see the polarization and how Americans, such a strong gun culture, that they're going to fight to the death, either in favor of or to oppose masks. We're lucky that in the Philippines, we're not like that. Well, we use tanks sometimes to make people use masks. So in the States, we're seeing all kinds of irrationalizations to oppose masks. The most popular one is we have YouTube postings here of a woman shouting at inside the supermarket, ano ba kayong mga tupa? That the people wearing masks now are too obedient. People also say that it's hard to breathe, and it's a real problem, which we'll go back into later on. Carbon dioxide poisoning, it's uncomfortable, it's ugly, it's not manly. Gideon talked about some of those. My whole point here is that you see how in the West, the use of mask is not embedded, and therefore when the medical mask comes together with political problems, you also get into more problems. Let's compare that with China, where China and Japan have masks are no problems. And I wanted to point out that there's a masks are called mianchi, which means materials that you use on the face. Okay, edge neutral, and it's broken down to many types. For example, there are certain masks used to fight evil spirits, and they're called qi. So a specific term yan. I'm sorry, lumampas tayo dito. There are many other kinds of masks, but I wanted to bring out something else called lianpu. In Chinese opera, I didn't know this as well. I knew there were opera masks, but I forgot that these were actually painted on. So I'm thanking Mr. Yang Kwang of the UP Diliman Confucius Institute, who gave me more information. He points out that lianpu is the face. In Peking opera especially, you paint in the mask, and they symbolize certain personality traits. Here you are, the different types of opera masks that are painted on. And this one's also interesting to show the differences across cultures. Like the yellow and white ones, the yellow and white masks represent people who are treacherous and ferocious. And the black one is actually bravery and uprightness. You see the difference, unlike in the West. And the purple one represents wisdom. I won't go through all the masks because we don't have enough time. In Sichuan province, they have something called Tianlian, which is face changing, Okay, so if you go to China, you should make sure to watch Sichuan opera. But my point here is that it's very theatrical. No, masks are used there. Very, very entertaining. Very, very symbolic. Okay, about in Manchuria, no? In Manchuria part of China, nga, they have a very long history of fighting plagues. No? So as early as 1882, you can see the original protective equipment that was used there. No? And then in 1910, there was another plague epidemic in Manchuria. You can see the face mask there. No? Ang punto lang dito is that China was very, very much exposed to the use of masks and other protective equipment. No? During the flu pandemic of 1918 to 1919, they again used masks. No? And this became part of culture in East Asia. Nasanay sila sa paggamit ng mask. And what's very important to point out is that people wear masks not to protect themselves, than to protect others from being infected. No? And I have a picture here. Oh, yeah, no? I was in Taiwan last year with a Buddhist group called Fo Guangshan. And the head there, I was greeting the head. He's 95 years old. And you'll notice people next to him are wearing masks. No? And they're wearing masks not to protect themselves from disease, but to make sure that their head, no, their great teacher will not get sick. Okay? Nakukuha ba ninyo ang punto dito? The mask is a social solidarity thing. It's a way to prevent illness from being transmitted. No? Ang lakas ng tradition na yan sa China, Japan na ano. So kahit sipon lang, nagmamask ang mga tao kung nagsasubway. No? Okay, so it's not surprising when COVID-19 broke out, masks were used right away, even before they were required by law. And today, you have mass production of masks from China. No? This was in a local grocery, and you'll see here all these masks coming in from China. No? They're called Kozao, no? And yan nga, no? They're very, very popular. Okay. So that's China. You can see now na bakit mabilis yung pag-ano dito ng mask, no? At ang tamang paggamit. No? Let's look at our situation in the Philippines of mask use. No? We have a very interesting, I mentioned to you, masks are associated with death. With the gold death mask of Oton, Iloilo, dating back to the 14th to 15th century. No? There's also a Cebu death mask, which is found in the Southwestern University Museum. No? So mask figure, parang in the Philippines, medyo ano din, no? We have evidence of the use of masks in here. Okay, we know that masks are very popular for festivals, fiestas, and for theater. No? This is, of course, the Moriones, no, in Marinduque. I wish we had more time to discuss them. Very, very interesting. Tapos sa Bacolod, the mascara. Mascara is actually mas, meaning marami, at saka cara is faces. No? And this is fairly recent. It started only in 1980 when there was a very difficult year. The demand for sugar had slumped and there was an inter-island vessel that sank. And the mayor of Bacolod said, let's have a fiesta of smiles. No? He supported it and it became an annual tradition. No? So you will notice that the mascara, all the masks are smiling faces. Okay? So that's a twist, no, that we in the Philippines came up with. No? Of course, we have masks in theater in the Philippines, especially for religious celebrations. Let's not forget things like the Passion and all of these are meant to educate people about religious tenets. No? And that's found, incidentally, also in Buddhism. No? So the masks are there to depict the characters, but they also are part of the entertainment and sometimes can be very playful. No? So the association with bandits is really from the West. It is not as deeply embedded, no, as the other functions of mass, meaning for entertainment, for education, and all. No? Now, what is not as embedded in the Philippines is medical mass. We do not know if we used mass during the flu pandemic in 1918. There was another pandemic in 1968. I don't know how many of you were born then. I was already around. I don't remember mass being used. Gideon pointed out how we did use masks, especially during the SARS outbreak, hindi naman umabot ng epidemic, and during the Taal volcano eruptions in January. And while we have very high reported use of masks, I've found in some research that I've been conducting that masks are not used consistently. No? It's not used when people feel they're at home, and in urban poor areas, your home is the entire barangay, no? Or if you're with friends. No? And when they are used, they often do not cover the nose and or the mouth. No? At least 30% of males in one observation I did. No? And then many masks that are out there may not be too effective in blocking the virus. I'll talk a bit more about that. No? Okay, so Pilipinas is sort of in between the West and China. No? We have high adherence, but it's not really that much part of our culture yet for medical use. No? To summarize what I've been trying to present so far, kung buong mundo yan, we know that masks represent a compulsion of human beings to become another. No? Yeah, nagiging ibang tao for many different reasons. No? And there's ambivalence in becoming another, from acceptance of playfulness and performance to a fear of concealment and duplicity, doble cara, and deception. No? Even in Hong Kong, they had some problems because protesters were using masks. And the Hong Kong government actually banned the masks only now and then recently made it required, no, because of COVID-19. Nagbago naman ang isip nila. I tell you, be very careful when you're in Hong Kong. If you're caught without a mask, 5,000 Hong Kong dollars ang multa. That is $600 US. No? Okay, practical, and we medical anthropologists, we look for practical applications. What does this all mean for COVID-19 prevention? It's clear that if humans are to survive this pandemic, we need to develop a culture of using face coverings, no? Not just masks. No? This means addressing the opposition and people's reservations. No? The ideological ones, like you find in the States, are the most difficult. No? And unfortunately, it's going to be resolved in a very difficult way through natural selection, meaning sorry na lang, no? Ang mag-survive dito ang mga tupa, no? The ones who are obedient. And the ones who are disobedient, they are committing suicide. The lemmings are used as an example. They don't really commit suicide. Okay. And we need to address also, see, Gideon talked about the physicality of masks. There are real problems that come around with the physicality of masks, meaning masks do make it difficult to breathe. No? And I wish a government would be more understanding and try to help to find ways. No? The advisories in other countries are very clear. With children, you have to be very careful. You do not use it in children below 2 years. And even older ones, if it terrifies them, you have to take out the mask and explain things to them. Sa mga elderly, katulad ko, medyo nahihirapan, no, with breathing. No? And people with asthma and other respiratory ailments. And there are breathing exercises that you can do, and you have to look for materials that allow easier use of the mask. No? And of course, Gideon pointed out that during exercise, actually the advice is not to use masks. And you never hear people talking about that here. No? And physical labor, naawa talaga ako sa mga trabahador who have to wear masks during construction workers, for example. No? And we have to be more understanding and find ways to explain they can take breaks. Okay? Wag lang silang mahuli ng pulis. No? Okay, something we forget also, that masks also block, masks muffle, no? Especially high frequency sound. No? So women are at a disadvantage when you use masks. You cannot be heard clearly. And human language is dependent on seeing the lips and facial expressions to understand what someone is saying. No? So it's a very real challenge. No? I'm sure you've encountered it in stores. No? Minsan hindi mo naintindihan ang clerk at siya rin hindi ka maintindihan. No? So it's not surprising why here in the Philippines, for example, people want masks where there is at least a depiction of the nose and the mouth. No? Kahit naka-paint lang yan. Okay. We also know that culturally, we need to address issues of aesthetics and status. No? Kailangan gawing social nga ang mga masks. This is not yet on the market. It will cost $300 now. No? There, you really look good in it. Okay. And we need more education on the proper materials for masks. No? For example, if you do your own, cotton is better, no? But it's still less effective than the blue 3-layered surgical mask. And of course, the N95 mask. But people complain also about that. No? But you can see in the Philippines, medyo kumalat na. No? masks are everywhere. No, you see them even sold by street vendors na naglalako nga. From street vendors to SNR, medyo social na supermarket. But some of these masks, I feel again, the government should have advisories. No, I found this mask in Green Hills, no, and I see many people using this. No, yung may parang valvula sa side nga, no, and that valve is actually a filter, but it is not a good filter. It actually allows the virus to get through. No? So if you see people wearing that, if they're your relatives, ang Filipino kasi we will not tell strangers, uy, mali yung ginagamit mong ano. No? And it's very clear in the packet. It says this is a fashion mask. It is non-medical. But people are buying it because they say that it is allows them to breathe. I actually tried it. It doesn't help to make you breathe. No? Okay, another point is that we social scientists feel that one must take the meanings of objects, no, including masks. No? And unfortunately, masks in the States are seen as government intrusion. They even say it's dumping of Chinese products. You have people saying that the KR95, which was developed in Korea, is not actually is inferior to N95. No? Mga biases dito. But polysemicity, which is recognizing many symbols, can actually be advantageous. No? We should follow the Chinese. No? These are different terms for the same object. No? It's another type of covering. No? It's a covering. It's a sheet. It's not a mask, but it's a sheet. Sometimes it's sold as Yin Tao, which means covering to prevent pregnancy. Sometimes it's sold as Wei Shang Tao, which is a sanitary covering to prevent certain diseases. No? And sometimes it's an Anshan Tao, safety covering, which was promoted during the AIDS epidemic. No? And they even sometimes call it the Rui Tao, which means the covering you use according to one's wishes. No? Natatakot ako baka may mga bata sa audience, but I hope the adults know what we are referring to. So it's the same object, but notice the Chinese have all these different terms so that whatever use you have for it, there's a name for it. No? Okay. And we perhaps need to develop terms also, playful ones. We have playful ones for the object that I was talking about earlier, no? Kapote, for example. No? And maybe for medical masks, we need to start doing that as well. No? WHO now uses the term face coverings to point out that there's a wider range now of possibilities. No? And that will include face shields. No? There is medical and that face shields can be actually more effective than cloth masks. No? And I'm glad to see kahit sa urban poor areas, may nagbebenta ngayon ng face shields, no? 50 pesos. And you can reuse them. And they're really better than cloth masks. No? The person on the right, you might know him. No? Medyo social yan na that's another type of mask that you can improvise. May konting ethnic ano pa dito with and you promote. Ano, I'll get back to that later on. No? My point is that public education should tackle the cultural aspects of the use of masks and other face coverings. No? So that a medical mask is less medical than something that is life-saving and still fun. No? So that it becomes part of culture as habit, no? Or kaugalian. No? On the right side is there's a museum in England that took old paintings and then they doctored it, nagdagdag sila ng mask, and they're using it as greeting cards. So that's a good way to make masks more entertaining, not as serious as you know when you talk about the virus all the time. Maybe we need to do that here as well. No? There's been an explosion of masks and shields trying to make them more fashionable. On the left side, those are made from Inabel, yung Cordillera and Ilocos fabric materials. And you'll see may mga sets na ngayon being sold from Baguio nga, na the set has a hat, it has yung naka-roll is the acetate, and then you have masks, no? So that you can make a shield wearing the cap and all that. No? So I've actually seen a lot of these improvisations, no? Yung ang dami kong mga samples dito sa bahay, no, of people creating new shields, and I'm happy because it means it's starting to be accepted in the Philippines. No? Okay, I'm going to be ending the long slides na lang. No? A warning here: there is no single magic solution in health and medicine. COVID-19 shows we cannot rely on drugs, we cannot rely on vaccines. Huwag tayong umasa pa sa medyo matagal pa yan. And while masks are important, we will not stop the pandemic using masks alone. No? See, Doc Gideon talked about a particular study that's actually from the proceedings of the National Academy of States, of Academy of Science, which was controversial, mainly because they were trying to promote masks as the solution. No? But we know that the solution comes from a combination of face coverings, hand washing, physical distancing, stay-at-home measures, and dito tayo mahina, testing, tracking, and tracing. No? And all of these require an understanding of culture and society. No? Dapat pumasok ang mga social scientists to advise people on how to go about that. That includes testing and tracing. I don't think the contact tracing is finding out how the virus is transmitted. They're not enough being done. My last slide, salamat na lang, matatapos na. No? My final recommendation is we need to have exhibits. We need to have more talks on masks. No? The Social Observatory of UP Diliman has started collecting and documenting masks. Maasa na ang Museo ng Katutubo Kaalamang might want to take this up. We will have a generation from now people looking and maybe smiling at the different types of face masks that we use in the fight against COVID-19. Maraming salamat. Let's get to the questions and answers.
Okay. Thank you very much, Doc. Thank you for your most informative lectures. I'd like to immediately jump to the Q&A. We have 4 or 5 questions that were fielded while you were giving your talk, Doc. The first question is from Ronel Bernabe. The question is, I think, directed to both the speakers. In the Philippines, aside from access to resources or the limited access to resources, are there any other reasons why some Filipinos do not wear masks or are reluctant to use masks?
Gideon, or ikaw
Yes,
man?
sir. Sige. Well, in terms of reluctance to wear masks, it really is very situational. So, as I said earlier in my presentation, people might feel that it makes them look awkward or unsightly, or they're not comfortable. So it can be personal. It can also be at the level of social, that baka may sense of hiya rin in some context in which yung mga iba hindi nakamask, so they might look out of place. So from the individual to the social, and of course, we also have to address people's medical concerns around face masks, including the elderly who find it hard to breathe while wearing masks, and people with asthma and other conditions. So we also have to address people's concerns about whether it's safe to use masks or not in those situations.
Yeah, let me jump in here. Economics is one factor too, because the surgical mask in blue, they're still very expensive, and although I think the price is going to come down, so people prefer to, even when they use that, they reuse it. Naawa ako minsan yung makita mo ang dungis-dungis na yung mask pero tuloy pa rin ang gamit. But having said that, I also feel bad because if you are the middle class or the upper class, masks, people have many masks. I saw one comment there na it would be good to do a survey how many types of masks do people have at home. I pulled up 2 of the shields that I have here at home. I have all kinds of masks here. This is my favorite one because it's easy to breathe with it. So besides the economics of it, you have the ease which people have with it, and yes, people do think of things like maganda ba yan, and then people like to have the ones with the mouth and the nose and all of this, so that's waiting to be studied as well, but I'm sure after this pandemic, during this pandemic, people would have accumulated masks, just people in our audience, I'm sure all of you have more than a few masks.
Okay. Thank you, Doc. We have a second question from Mark Sandoval. Actually, it's an observation, but it poses itself as a question also. As receivers of oral communication, seeing the movement of lips greatly enhances understanding, even if the audible aspect of the language is maintained. Having opaque masks then impairs oral communication. Do you agree? I mean,
Agree na agree, no? That's why I like the shields, no? And there are also proposals, maybe even with masks, no? If there's a way to have it transparent, no? But I think shields are the way to go because you see the whole face. No?
okay. Sir Gideon, would you like to comment?
Yeah, I really agree so much. In fact, when I'm doing interviews now, as part of our ethnographic, we're trying to do virtual interviews. Sometimes walang internet, so I do phone interviews. And in my experience, dahil nga hindi mo nakikita yung tao, and it's the same thing with wearing a mask, you really have to be more, I find myself being more expressive with my voice. Because kung in normal circumstances, dahil nga we rely on our facial expressions to communicate. So I don't have to do it that much, but I find myself being more expressive and emotive when it comes to the audio or the auditory aspect of it. So we also see how it's not just the face mask that's an evolution, but also the way we communicate will also have to evolve given what's happening.
Okay, thank you. We have a third question. This one is this one hits home kasi parang familiar yung mag-inquire sa inyo, Doc. I'll read it as it is. Mike, weren't you reprimanded for not wearing a mask when you were with their head, or because you were a visitor? Hindi ka ba sinita? Referring to your visit in Taiwan.
Hindi naman. No? Because there's no pandemic yet. That's why I showed the picture to emphasize nga, kahit walang pandemic at the time, that was last year pa. No? Oh, you mean because I was going up to the task of the head of the organization? No?
Yes.
There's no compulsion there. It's like I said, it's a civic duty and it's etiquette na and I think they probably felt also, I'm just passing visitor. Yung dalawang madre na nasa tabi niya were sitting with him for a prolonged period. No? That group, incidentally, is interesting. They were the ones who gave me this mask here. No? And I think there's relevance pointing out. They call it the 3 acts of goodness. You have to think good, you have to speak good, and you have to do good. And I think that might be a good slogan for the mask. No? We have to start thinking of mask as doing good. No? Sa ngayon kasi parang pinipilit, no? Kung walang pulis, sige, huwag mo na. No? But if we can look at it na kusa na lang that we do it because we know it is good for people.
Okay. So, okay. Thank you, Doc. The question was from Macy Faith Tagapioso.
Yeah, hi Macy. Kilala ko siya ako.
Okay. We have a fourth question. I suppose this is directed to both the speakers. From John Daryl de la Rosa. Hi, sir. What's the use of wearing a mask when it is sold everywhere and sanitized? It's like asking the masks are being sold are compromised in the first place. So do they help with the medical objectives of their use?
You want to tackle mo na, Gideon?
Sige, sir. So, in response to that, I would like to, well, first of all, nakikita ko rin yung comments, and I would like to acknowledge yung mga fellow MDs who are saying na face masks and face shields are the better pa rin both. So, this is really a rapidly evolving issue, and the use of face shields is really something that we really need to study in terms of its effectiveness. Parang kanina ni-recommend yung, I think Harry Roque was talking about face shields. Pero I'm seeing in the comments people saying na wala pa ring papalit sa masks in terms of the droplets. So definitely we really need the expertise to explain to people exactly why this is the case so that people will be informed. So in relation to the question on how to make people use masks more, definitely it should not just be about compliance. The last thing we want to happen is people to wear face masks and coverings just because they're required to. Kasi they need to really understand and they really need to be convinced that wearing the face mask is something that is not just a requirement, but it's something that they can use to protect themselves and also to protect other people. So without this kind of motivation, if people will just do it, and I see it in my own observation, I see people na pag wala naman yung medyo malayo sila sa police or sa barangay, then they would lower the mask. So it's very important to convince people indeed and to understand why they're hesitating to use face masks. And for that, we will need to really talk to them and learn from them. It cannot come from experts. It has to come from the people themselves.
Let me pick up that point about unsanitary. But if you buy cloth masks, do wash them first. No? Tama din kayo, no? I mean, it's being sold the street side and all. No? And of course, cloth masks can be rewashed. No? Even surgical masks, no? In times of scarcity, medyo pwede, no, na, but I'm feeling uneasy. But even hospitals are now reusing the N95 kasi kulang na kulang. No? Something to go is to use ultraviolet sterilization. Magugulat ka, meron na rin sa mga hardware. No? I found one which 2,000. It's a little box of plastic and you could put your mask there, exposed for Don't forget ultraviolet radiation can come from the sun as well, but I don't think it's reliable. No? But that is an example again na kulang din na explanation. Yung isang daw is you should not touch the mask when you put it on. No? But the reason there is that you might have touched a surface na may virus. Then when you touch your mask, diretso yan, first class trip yan para sa virus papasok sa So the advisory should have said na if you're going to touch your face, and we have to touch our face. No, once we have it, this is the way to put it on. No? Once we have it, sometimes we have to adjust it. Just make sure you have washed your hands and you sang happy birthday twice, no? Before you touch or readjust the mask. No? But this is an example to Gideon and I will probably take this up to. The problem also with medicine is sometimes they want to be so precise, no? Like they say, naku, if there's a little, you have to make sure it fits tightly and all. No? My view here is that, if there's a little, unless someone really coughs into your face, no, into your nose, you're not going to get that. And if you keep doing, if you have such stringent requirements, mapapagod ang tao eh. There is something called care fatigue. You're telling people you have to put it on, you have to make sure that there's no air coming out, and you have to keep it on all the time. They're not going to comply. We have to be able to allow some allowance, no? And people also forget to tell people. People should be told, yes, you may take it down sometimes kung wala kang katabi, kung may physical distancing. No? Then you put it back on again. Okay.
Okay. Thank you, Doc. Just another question from Agnes Almario. You mentioned this a while ago. With the surge in the use of surgical masks, how will the mask affect the environment when not properly disposed of?
It's going to be a problem. No? Nakakatakot nga eh. It's not just environmental. Kasi may may microbio din yan. No? Don't touch a mask if you see it lying around. You don't know who used it and all this. No? So yes, there will be an environmental problem. Gideon, do you want to add anything there?
Well, dahil nga ngayon, it's a public health emergency, so people think that it's an exceptional situation. So pwedeng mag-backseat muna yung environment. But of course, as this drags on, as this pandemic continues, and we're now into the several months of this, these issues around the environment need to be taken seriously as well. Kasi alam naman natin na ultimately, the pandemic is also environmental in its origin. The way we relate to other animals and to the environment in general. So we cannot just dismiss these environmental concerns. And we need to pressure, siguro, yung mga manufacturers of masks should really start thinking about how to make these face masks more environment friendly. So that conversation needs to happen as well.
Yeah. May pitch din tayo dito no, kasi we were already moving into a phase out of single-use plastics. No? Kasi sige, may ordinance na. Tapos nangyari ito and suddenly people are saying that you have to use disposables. No? And many restaurants can just use disposables. But people are, kaya dumadami naman ang plastic use of single-use plastics. Na, no? People are forgetting an alternative is to urge people to bring their own eating utensils. No? In UP, we were ready to implement this na may discount sana ang restaurant or concessionaire kung nagdala ng sariling gamit ang tao na. No? And I would urge that, no, who do you trust but yourself? No? So you should bring your own. No? Are you going to rely on the restaurants kahit sasabihin nila single use yan? Ako, I would still feel more comfortable using my own.
Okay, thank you, Doc. Doc, we have a lot of questions coming in, but I'd like to end with last two questions kasi mukhang this will take the inquiries home. One of the last questions, Doc, for both you and Sir Gideon, or Doc Gideon, what is your recommendation of how we should use the masks now at the time of COVID? Is there a proper way? Will you recommend?
A proper way.
Yes. Are you partial to the shield rather than the masks? Or are disposable masks better than the cloth ones?
Yun, medical ethics muna. Ikaw muna.
I would personally defer to the experts. I mean, even though I am a medical doctor, I have to acknowledge that my own expertise as far as which masks to use is not at the level of those who actually study this. So as a medical anthropologist, my calling is to understand how people use masks and their attitudes towards masks. But in terms of which masks to use, we will have to go with the official recommendations and really try to keep ourselves updated with the latest findings. So ngayon, they're really discovering that probably aerosol transmission is responsible for a lot of the spread. And this is just a suggestion, but at the same time, we need to really be updated with these studies and apply them accordingly. And we cannot stick to one recommendation because what we say now might not be applicable in 1 month time. Kasi the epidemiology also changes. So I'll have to defer to the experts in terms of that particular question because I think it's a medical question.
Okay.
I wanted to greet Dr. Esperanza Gatbonton, no, who was my student. And she's expert on gold. No?
Hi, ma'am.
You remember the gold mask. Anyway, it's a hard question to answer because maraming yan. I mean, if you want to be very broad, cloth masks are less effective than the blue mask as the surgical mask, which are less effective than N95. No? But then even with cloth masks, cotton is better than polyester, maraming mga dito. No? And I think people might get so bothered by what is the most effective and end up not using. Ang mas importante kasi dito is using it properly. Kahit naka N95 ka, if it is not used properly, it's not going to protect you. No? And remember again, the masks and the shields are only part of the bigger package nga. No? Maybe just to give an example there. Let's be very clear, aerosol transmission here, iba yan sa nasa hangin. No? I keep worrying people start thinking na nasa hangin yan. No? Actually, okay nga sa labas, mas safe ka sa labas sa hangin. Ang sinatawag na airborne transmission is when you are inside a room and someone is infected at pumasok yung micro droplets na lumabas nga sa bibig niya o sa at it stays suspended in the air, especially if it is kulob, no?
and especially if you're using air conditioning because it only recirculates it. No? So hindi lang mask yan, it's also a matter of being able to have the air circulate and to move out. No? It's a matter of how far you are from them. If you are inside a room with someone who's infected and there's bad air circulation, 1 meter will not be enough. That was what was so shocking. No? They were saying, kulang yung 1 meter. No? And yet if you're outside, you know, you are actually safer. You can be 1 meter apart. No, there are a lot of people who are having meetings right now, outdoors nga. No, so weigh the physical distancing, weigh the mask use, the hand washing. Actually, doon tayo mahina sa Pilipinas, ano, lalo pa sa mga mahirap, wala namang tubig, no. Because if you don't wash your hands and you pick up the virus, you're actually going to have more problems with the mask. No, they call it auto inoculation. No, you touch your face and you bring the virus to your face. So let's look at it as a package, you know, and provide all the information that people need. You know? Gideon?
Okay, that question was from JJ Moises. Last question, Doc, for both of you. Anna Bondok makes a point. He says she has the impression that there are aspects of our culture which are, to quote her, parang kalaban natin sa paglaban dito sa COVID outbreak. Filipinos love inuman, sabong, parties, hugging. Yun. Now she would like to ask, and this is the last question, how can we use the other aspects of Philippine culture to help us combat this pandemic? What is your message on this regard?
You want to go first, Gideon? It's almost countercultural nga, because we are a hugging culture. We are we touch each other all the time, and it will take extra effort to remind ourselves hanggang ngayon, after 4 months, I'll meet someone, they want to shake my hands, they want to hug, and then they'll be the ones, hindi pala pwede, no? And I've learned also to, inuuna ko na sila, uy, matanda na ako, huwag kang lumapit na, no? And they take it in good stride, no? But and I always tell them, I would like to hug you so badly, pero hindi pwede, no? At dapat masanay tayo. This is part of creating a better normal. I do not want to use the new normal. We have to learn how to show our affection, our intimacy, our connections nga, even without actual contact, no? Until the vaccine comes, but that's going to take a while. No? So it will need extra effort, but it does not help when you round up people just because they forgot that, or they're sitting in front of their homes. Hindi pwede, kasi we are a lagot culture. Lagot meaning, lagot ka, makakita ka ng makuhuli ka ni tatay na. So kung wala si tatay, then we misbehave. And it has to be really, dapat maging kusay ito na magdistansya tayo kasi I want to protect you. I love you, so I'm going to keep my distance. No? I will wear my mask and all. Maybe we should play on the love thing. No? Mahal kita kaya kaya hindi kita yayakapin.
Okay. Would Sir Gideon want to weigh in?
Well, I just want to echo what Sir Mike said. And at the same time, to reiterate a point that he made earlier, that we need to frame this positively. It cannot be punitive. It cannot be a matter of shaming. So some questions are around shaming. It should not be that way. We can make it fun. We can make it playful. We can make it fashionable for people. So we see a lot of people posting selfies with their masks, diba? Kasi for them, it's something new as well. There's novelty in masks, and we can tap into that in a cultural way, while at the same time acknowledging that culture is not the only barrier to mask use. There are real material and financial needs for people. Even yung paglalaban ng cloth masks can be a challenge for communities where there's no access to water, for example. So we cannot essentialize this as merely a matter of culture. Although napakalaki talaga nga ng bagay that we understand what masks take away from us, which is the affection, the communication, and find creative ways to still fulfill those cultural needs, but at the same time encourage mask use.
Okay, thank you. We have so many more questions, Doc, but what we'll do is we'll forward them to you. Our administrator is compiling them, and we hope we will be able to answer those queries that were unanswered. Thank you, Doc, Chansey, Doc Gideon, for engaging us this afternoon. We'd like to turn over the session to Ms. Cora for the concluding portion of our discussion.
Thank you, Raymond. And this will be short and sweet. Can you hear me? Can I be heard at all? Mike, copy. Walang mano po, walang beso-beso. Di ba? Talagang ginagawa natin. So, Gideon, Dr. Lasco, may this be the first of many. We reiterate our sincere appreciation and profuse apologies for the technical difficulties. Huwag po sana kayong madadala. We thank you all very much for your participation, our audience, for your kind patience and understanding during our difficulties earlier in the session. Dear friends, do continue to stay safe. We hope to see you during our coming online activities. Marami pa yan. And by the way, we are on Facebook and Instagram, and we invite you to like us. So, we will meet again with that song from Vera Lynn Goes. In the meantime, have a fine evening and a wonderful week. Maraming salamat.